NHS England exists to deliver improved health outcomes for patients. And to do that, technology is absolutely essential. Technology is the means by which we can generate tools and services for professionals, for clinicians, for patients and citizens at large that will enable us to make a reality of that mission. We need seamless flows of insight into the outcomes patients are experiencing right through the pathway of their care. The way in which we can do that is by having data that's interoperable. We also believe that technology, as in many other industries, offers hospitals the opportunity of becoming more productive.
What we know is we're on the verge of a quantum step forward in terms of the way we use digital technology to support the delivery of clinical care right across the spectrum of health services, from primary to community into hospital care, and how we really support clinicians delivering safe and responsive care to patients.
In order to achieve this sort of change, we need leadership at trust board level from people like Chief Clinical Information Officers, and we're very pleased with how that network is developing. But we also need leadership all the way down. So if you take the example of an acute ward in a hospital, then you're going to need a sister or a senior nurse who says that personally they're going to take on this project, that they're going to make it work and push it through till they achieve benefits locally. One of the examples of something we can do to help is to make sure we're putting the right devices into the hands of those healthcare professionals. And one example of that, which many people have seen from their own everyday life, is that if we can use mobile tablets, wireless networks, we can get decisions made right next to the patient's bedside, possibly with the patient involved. And that's going to be a lot better than asking doctors and nurses to move backwards and forwards between bedside and nursing station with scraps of paper in order to get to a computer that's sitting somewhere else.
Of these systems that produces the best and safest care is absolutely critical that we engage staff right from the very onset in these projects. And the way to do that, and the best evidence from the successful trusts in the NHS show this, is they weave into their strategy and their narrative and their story about what their organisation is all about, the key role of introducing new technology and digital support to clinical teams.
One example of that is we can be sure that we're giving the right drug to the right patient at the right time, and that we have a record of that. And that's something that's very difficult to achieve with paper-based systems.
The reason why there is such enthusiasm for the whole digital technology project amongst clinical staff is that they understand that if they introduce the technology properly and look at their processes and adjust their processes and in some cases radically change what they're doing, that what this will have is a major impact on the safety and quality of care that they can give to patients.
Something that we can achieve with computerisation is to make sure that at each encounter with the patient, the healthcare professional knows who else is looking after the patient, what else is planned for the patient, and what the patient has been told and thinks about their own condition. We can make sure that happens within organisations, but also across organisations.
This is about unleashing the power of people. Data and technology offer us the biggest chance we've had to deliver high quality care for all sustainably. That means now and for future generations. We need an NHS that is technologically far more adept, that recognises the potential for digital services to drive not just the safety of patients on our wards, but also put them in a position to take much greater control of their own health and well-being. We see a kind of digital revolution being almost the precondition for a sustainable, high-quality health service.